Hello, everybody. So today I'm talking about stillbirth. Now, stillbirth simply means when the baby dies in the womb. Now, majorly occurs after 28 weeks of gestation. Now, mostly how will mothers know that their baby is dead, or how will they suspect that the baby is dead? Mostly occurs when the mother cannot feel the fetal kick of the baby anymore. So normally, maybe you normally have a way of babies to kick, but you discover suddenly that there's no more fetal kick. You should be suspecting that the baby is not fine. So one of the early signs for the mother is that the baby will stop kicking. Now, when the baby stop kicking and you go for scan, now the scan will show you that the baby heart is no longer beating. That is when you know that the baby is dead in the womb. Now we'll talk about how we'll talk about the causes, and then we'll talk about how to prevent fetal death. That is stillbirth. How to prevent stillbirth. So in this video, we're going to talk about how to prevent stillbirth and what are the causes of stillbirth. Now, let me go to the causes now. Now, stillbirth is caused by many factors. One of it is from the placenta. Now, you know the placenta is what transfers nutrients and oxygen to the baby from the mother. Now, if anything happens, for instance, that the placenta become detached from the mother's womb, now meaning the oxygen and the nutrient no longer goes to the baby in the womb, and this can lead to the death of the baby in the womb. Now, one of the causes of such thing is high BP in a pregnant woman, especially when the BP is not controlled, it can cause to that placenta abruption also. Another cause is when the umbilical cord. Now, umbilical cord is what connects the placenta to the baby in the womb. Now, when the umbilical cord is compromised, let's say for instance it becomes twisted or is now compressed, meaning the oxygen and the blood also is no longer going to the baby. This can also lead to fetal death in the womb. These are the causes that come from the umbilical cord and then from the placenta. Now, another one comes from the maternal health himself. Now, if the woman is having sickness or disease that she is not trying to correct, such as diabetes. Now, if a woman is having diabetes, gestational diabetes, while pregnant, and she's not taking her medication, now some people don't even go for antenatal, so they're not even aware that they're having that issue. So the issue can go on for some time and lead to death of the baby in the womb, and that is when maybe after that they go to the hospital, doctor now find out, okay, you're having diabetes, you didn't take your drug. This is why the baby died. Now we also have BP, as I said earlier. Now BP, when BP is high and then you are not controlling it, also dangerous for both the baby and for the mother. But that's another story for another day. Now I'm focusing on the baby now. Now it can lead to that placenta abruption, as I said earlier, and other factors that can lead to death of the baby. So maternal health is also important. Another one is when the mother is having kidney issues. It still can lead to death of the baby. Now there are some other infections, viral infection and bacterial infection also can lead to death of the baby in the womb. Now we'll talk about the maternal health factor, the placenta factor. Now we're going to talk about environmental factors. Now one of the causes of stillbirth also is smoking. Now, most women are arguing with you that I don't smoke, I don't drink, I don't do that such things. But now, if you move close to people that are smoking, or you like inhaling it, or you're in a place where people smoke a lot, now it also had the same effect like the person that is actually smoking too. So, in as much as you're not smoking while pregnant, it is good to avoid where people are smoking so that you don't inhale it. Now, for some people, it's their spouse. So, if you know your husband, it's advisable actually to stop it. But if your husband cannot stop it, please, the husband should smoke outside the house while you are inside to avoid such hazard from happening to your child. And another one is alcohol consumption. Now, it is advisable not to take alcohol at all in pregnancy. That is the advice. So, because alcohol also causes a lot of issues apart from the stillbirth we're talking about. There are some other genetic factors that can cause abnormalities in the baby, most times cause the death of the baby in the womb. Now, it is good for you to know that some of this stillbirth actually happens even without any of these factors coming in play. So some just happen without the doctor being able to identify what actually caused the stillbirth in the woman. Now we're going to talk about how to prevent stillbirth. Now one of it is when you notice that your pregnancy is becoming advanced, let's say from 24 to 28 weeks, you should always sleep at your side. Now, you cannot sleep on your back or on your abdomen anymore because this actually put the baby health at risk. So always sleep by your side, either on the left hand side, the right hand side, whichever one you prefer, but avoid sleeping on your back or on your stomach. Now, you should always be conscious of your baby's fetal movement. Now, if you notice that it is becoming less frequent, please go to the hospital immediately where the doctor will monitor your baby and find out. And if there's any intervention that is needed, they will, or if there's nothing, they give you reassurance. It's always better for them to tell your baby is fine than for you to sit at home while something bad happens to your baby. You should avoid smoking and avoid when people smoke so that you don't inhale it also. Avoid alcohol, avoid taking hard substances. This will give your baby good health and prevent stillbirth in your baby. And importantly, please always go for your antenatal clinic. So if you go to antenatal clinic, the doctor is always going to check you, do general checkup on your own health and that of the baby to make sure there's no health risks for you and the baby. If you have any underlying illness, please always take your medication, but follow your doctor's advice so that it will be well maintained and it will not pose any health risk to you and your baby. Thank you very much.